Hi, I'm Dr. Letizia De Mori. I'm psychologist, neuropsychologist and researcher at private therapy clinic. My biggest expertise is to understand how brains works. So that means understand functionality and connection, neurotransmission inside the brain. What I do is to design cognitive profile to understand weakness and strengthens points inside brain functioning. That could be linked to the personality profile. So what I do to help people is to understand themselves. When people come to see and meet me, it's because they need a very quick answer about their behaviors, their feelings, their emotions. So the process takes few steps. The first is what we call clinical observation. So it is about 1.5 more or less long period to collect data and understand clinical and personal history. So from this point, I will decide with the client how to proceed in terms of assessment, test, questionnaire, understand the main reason of their difficulties. Something different is when people come to me to understand what to do after a brain injury. So the process is easier, but in terms of building a program, because we know from where start, because there is a brain injury. So from there, we start with the neurorehabilitation. So people come to me to improve their functioning, even with or without brain injury, and understand how to proceed, how to upset, how to be and live with their characteristics, ADHD, autism, learning difficulties, learning disability. From that, with the assessment, the data from the assessment, the data analysis, we will understand how to proceed after. So that means which program is the best for this type of client with this type of difficulty and fragilities. Another important step during the process is to build a tailor-made program to improve the functioning. So in two different directions, it's possible to build programs. So what does it mean? That means with brain injury, of course, the pathway is completely different because you need to improve the damage that you have. So that means using specific software, specific exercise to work exactly where the damage was inside the brain. With different position, it's how to make the functional better without damage. So that means increase functionality of the brain, but with a different point of view. That could be include psychological treatment like psychotherapy and maybe a medicational treatment. So after that, the client usually always receive suggestion, recommendation how to proceed with the next steps. A good practitioner should be very good in their science field. So that means be ready to answer to many questions from clients. That includes work without prejudice and starting from a different point of view. So excluding different aspects of the problem, of the difficulty, of the fragilities. From my point of view, be a good practitioner means evaluate the case, excluding clinical, organic dysfunction, disorder, to be focused on the real problem, difficulty, issue. Once that I have the answer, I can explain better to the client how to proceed. And from this point of view, from this point of the journey to be with me in the evaluation process, probably I will recommend how to proceed. So that involved my colleagues in private therapy clinic, because many times a client should need any other treatment, psychological treatment, medicational treatment, and for that we have other colleagues. So be a good practitioner means always be ready, always be a complete practitioner and have a good team inside of you. Yes, I had and I have my personal psychologist, also because it's one of the requirements to be and become a psychologist. I have your own opportunity to speak with your own psychologist. And before to be practitioner, before to be psychologist, we are a person with emotion, feelings and limits as anybody else. So we like to have our own psychologist to improve our quality of life as anybody else. My interest is always focused on science fields, so that means in my free times I'm always trying to find new studies, new solutions to improve brain functionality, and this includes improving quality of life of people.